Greetings and salutations, everyone. We are going to be talking about chapter 16 in our microbiology book today, and that is going to cover gram-negative bacilli and coccobacilli. Some things that we're going to be discussing are some mechanisms of disease transmission of opportunistic microorganisms. This isn't a new concept for us. Identifying body systems involved in infections by pathogenic species of Proteobacteria. We'll also talk about gram-negative bacilli that are frequently responsible for healthcare-associated infections. And lastly, we're going to do some comparing and contrasting of the pathogenicity and disease expression in various taxonomic families with class Gamma Proteobacteria. It's gonna be a bumpy ride, so buckle up, buttercups. One of the bad guys on our list of bad guys for gram-negative bacilli and coccobacilli is E. coli. E. coli lives in our intestine. It's a gram-negative rod-shaped bacteria, and it does help us, right? It helps us by producing vitamin K. However, if it does get outside of that normal realm, there could be trouble. And we've already talked at length about bowel technique, but this really ties into what we're doing in the operating room as far as making sure we maintain strict bowel technique when we are working with the gastrointestinal tract. So we make sure that we prevent potential contamination of to other areas of the body, right? So there's the WIFM for us in studying gram-negative bacilli and coccobacilli. Proteobacteria are broken down into classes: alpha, beta, gamma, delta, epsilon, and zeta. The ones that have been identified as being pathogenic to humans are alpha, beta, gamma, and epsilon. That means delta and zeta are not pathogenic to humans as of yet anyways. They are classified as either gram-negative bacilli or gram-negative coccobacilli, and they are among some of the most pathogenic species of bacteria belonging to Proteobacteria. Some of the classes of bacteria, alpha, beta, gamma, and epsilon, some of them we've already looked at, and others will be new to us. In this chapter, the book gives a little shout out to Brucellaceae and talks about it more in the following chapter, chapter 17. So here we're just going to kind of lay the groundwork for this bacteria. Brucella are small aerobic gram-negative bacteria. They are non-motile. They do not form a capsule, and they are considered intracellular parasites. And these little bacteria are ingenious. So listen to what they do. They infect the reticuloendothelial system, the RES. Now the RES is comprised of tissues that are lined with phagocytes and make up a big portion of our immune defense. Tissues like the spleen, the lymph nodes, the bone marrow, they line themselves up along these tissues after they invade the host, and guess what happens? These phagocytes engulf the bacteria. How ingenious is that? And then the monocytes or macrophages that have engulfed these bacteria carry them to areas of the body like the liver, the kidney, the spleen, the lymph nodes, the joints, the breast tissues, and the bone marrow, just to name a few, where they proceed to destroy these respective tissues. There's 6 species of Brucellaceae, and 4 of them are pathogenic to us, the humans. These are considered zoonotic infections, which means diseases that are transmissible from animals to humans. And they are, starting with the most pathogenic is B. melitensis, and that comes from sheep and goats. It has the highest degree of pathogenicity, followed by B. sui. Guess where that's from? Sui. That's from swine. B. abortus, which is from cattle, is the next in line for most pathogenic. And then B. canis, which comes from dogs, bringing up the rear. So that's just kind of a little appetizer about Brucellaceae. I just like saying Brucellaceae. Kingella is a member of the class Beta Proteobacteria, and it is within the family Niceraceae. There are 3 different species that we're going to talk about here, and that is Kingella kingi, Kingella denitrificans, and Kingella oralis. These guys are gram-negative, short, non-motile coccobacilli, and sometimes appear as cocci as well. Kingella kingi is gram-negative coccobacilli, and is mainly been identified in children. It likes to colonize in the respiratory tract and the oropharyngeal tract. And it can cause bacteremia in infants, osteomyelitis in younger children, and endocarditis in school children as well as adults. Diagnoses of Kingella kingi is frequently missed because invasive forms are very rare. Now, Kingella denitrificans and Kingella oralis are coccobacilli, but sometimes may appear as diplococci, and they are very similar to Neisseria gonorrhoeae. These are commensals in the mouth and the pharynx, and do also reside on our gums and our teeth. They're rarely pathogenic. However, if we get our teeth cleaned, let's say, and there is some bleeding of the gums and such, this may lead to transmission of the bacteria into deeper tissues and perhaps into the blood vessels, which could lead to endocarditis. Chromobacterium is also in the class Beta Proteobacteria. It is also from the family Niceraceae. It is a large, curved, rod-shaped bacteria, and it produces the one that we're going to talk about called Chromobacterium violaceum. Is the only bacteria that is known to produce this violet-colored pigment known as violacine. And it is typically found in the soil and water and animals. It is not part of the normal human microbiome, and areas like the southeastern region of the US and tropical areas of Southeast Asia and South America are where it likes to live. While infections are relatively rare in humans, they can be fatal even when we do treat it. Typically, the way that this bacteria gets into the host is through an open wound that's been contaminated with water or soil that has the bacteria living in it. It can cause cellulitis, wound ulceration, lymphadenitis, septicemia, osteomyelitis, organ abscesses, urinary tract infections, and eye infections. The reason why it is so virulent is because it produces an endotoxin that helps it evade phagocytosis. Now, scientists did recently discover a different strain of Chromobacterium, and they're calling it CSPP. And so this CSPP strain, they have found living in the intestinal tracts of mosquitoes. And these are the mosquitoes that specifically carry malaria and transmit that from person to person. And what they have found in their initial studies is that this Chromobacterium might reduce the mosquito's ability to transmit malaria. And in the lab, as they're studying it, they found it to be harmful to vectors, to bugs. And so they're looking at ways that they could harness the powers of this CSPP strain to maybe help them fight against some of these global diseases that are carried by vectors. Alcaligenaceae are gram-negative bacilli or coccobacilli, and they are found in our environment. There are a few strains that are pathogenic to humans, and those are Chromobacter, Alcaligenes, and Bordetella. There are other strains that are more pathogenic to other mammals and birds. They have isolated another strain called a Chromobacter xylosoxidans from indwelling catheters, and as such it has been listed as a potential cause of healthcare-associated infections in oncology clinics. Now, Bordetella is the most recognized member, and it is strictly aerobic coccobacilli, and these are gram-negative. And the three species that cause disease in humans are Bordetella pertussis, B. parapertussis, and B. bronchoseptica. Pertussis is the most virulent of the three, and it causes the disease pertussis. This is also referred to as whooping cough, and it's a disease we primarily see in infants and children, although adults are susceptible. And there is a vaccine for this. It is our Tdap, which is for our tetanus, diphtheria, and pertussis, so it's important that we get that. Some virulence factors associated with pertussis include a protein that it secretes from its cell wall, which helps it adhere to the respiratory tract, and then another toxin it secretes that increases the release of histamine. It also secretes an enzyme that inhibits phagocytosis and another exotoxin that's purpose is to destroy the tissue of the respiratory tract. Enterobacteriaceae is a gram-negative and non-spore-forming species of bacteria. Some of them are motile while others are non-motile. And these guys are mesophils, so they like the temperature of me and of you, 98.6 to 99 degrees Fahrenheit. So there's a couple different ones we're going to talk about. We're going to talk about E. coli, and we're going to talk about Enterobacter. E. coli, as we know, is a commensal microorganism. It lives in our gastrointestinal tract. It also lives in the GI tract of other animals as well. These are gram-negative rods, and if they get out of their normal realm of the GI tract, they cause E. coli diseases. And these diseases, there are 5 types of strains that cause these diseases, which are enteropathogenic, enterotoxigenic, enterohemorrhagic, enteroaggregative, and enteroinvasive. And they cause situations such as urinary tract infections, sepsis, diarrhea, and neonatal meningitis. Now, E. coli is going to be discussed more in chapters later on, so stay tuned for that. Moving on to Enterobacter, it comes from the class Gamma Proteobacteria. They are rod-shaped facultative anaerobes, and they are motile with peritrichous flagella. See this little furry guy at the top? That is an Enterobacter. There are 2 species that are highly pathogenic to humans, and those are Enterobacter cloacae and Enterobacter aerogenes. These are 2 major contributors to health care acquired infections, and their virulence is dependent upon an endotoxin that they secrete from their outer membranes. Enterobacter infections are often referred to as ICU bugs because those individuals that spend a length of time in the intensive care unit are at a higher risk for Enterobacter infections like bacteremia, endocarditis, septic arthritis, which is in the image that you see here on your screen, and osteomyelitis. Also can contribute to infections of the central nervous system, the lower respiratory tract, the peritoneal cavity, skin and soft tissues, UTI, surgical sites, and the eyes. Other factors that put individuals at a higher risk for Enterobacter infections is being in the hospital more than 2 weeks, undergoing invasive procedures in the past 72 hours, if they have central venous catheters, or they've had treatment with antibiotics within the last month, or if they have had recent use of broad spectrum antibiotics. In addition to that, the elderly and neonates are at a higher risk. Now, typically, these guys don't bother healthy individuals, but in individuals, again, with a poor immune system, they're going to be, again, at a higher risk for developing those. Now, there's one other strain I want to talk about, and that's Chromobacter saccozacii. And I'm pretty sure that might be some kind of like Japanese alcohol drink. I'm not sure. This strain can cause meningitis, ventriculitis, which would be inflammations of those ventricles of the brain abscesses, cerebral infarctions, cyst formation in neonates and little ones that are around 2 years of age. And this Saccozacii likes to live in very dry environments and has been associated with outbreaks due to contaminated dry powdered formula for infants, as well as other foods that come in powder form. The way that we diagnose this is through culture, and we could culture the blood or urine. They may also request x-rays, CT scans, MRIs. They might potentially also schedule an ERCP, which is an endoscopic retrograde pancreatography. And that's going to be to look at the biliary tree to see if there's any blockages. They can also do soft tissue or bone biopsies, take some cultures of any type of drainage that might be coming from a surgical wound. They may also do lumbar punctures to culture the CSF. All infections from Enterobacter, we're going to treat both antibiotic therapy, but it's really important that the care provider doesn't just throw a bunch of antibiotics at this, hoping that it's going to go away. They need to be very careful in prescribing something that is going to treat. And so that's why it's important that they get a diagnosis, a correct diagnosis of what the bacteria is. Prevention is going to be the best thing here. Isolation precautions for any patient that has an Enterobacter infection, proper hand washing, proper disinfection, and preventing cross-contamination. Another organism in the family Enterobacteriaceae is Klebsiella. And Klebsiella gets its name from the German microbiologist who discovered it, Dr. Klebs. And these are non-motile, rod-shaped, gram-negative bacteria, and they are also facultative anaerobes. They have a polysaccharide capsule that make it more resistant to the host defense mechanisms such as phagocytosis, and it also contributes to its resistance to antibiotics. Now, while Klebsiella is a part of the normal flora of the colon, if they get outside of the colon, similar to E. coli, they can be pathogenic to us. Some species that are most pathogenic in regards to Klebsiella are K. pneumoniae, K. oxytoca, and K. granulomatosis. Pneumoniae is the one that's responsible for respiratory tract infections, has also been found in the stool in a small percentage of healthy people. And Klebsiella, again, is a common pathogen in healthcare acquired infections. Infections caused by Klebsiella include the biliary tract, respiratory tract, urinary tract, and surgical wounds. They are frequently a causative agent of pneumonia, bacterial septicemia, cholecystitis. I put a picture of the gallbladder on there for you. It's on the bottom of the slide here. That big purple thing kind of coming towards you is the gallbladder. Klebsiella also contributes to diarrhea, osteomyelitis, and meningitis. In other instances, it's been linked to invasive devices, ventilator equipment, and indwelling urinary catheters. It is also becoming more resistant due to inappropriate use of antibiotics. K. oxytoca has been isolated in NICUs, or the neonatal intensive care units, resulting in neonatal septicemia. There are some also less common infections that the text talks about, such as ulcerative disease, chronic inflammatory infections of the nose and throat, and also chronic atrophic rhinitis. The way that we diagnose this is similar to the others that we have talked about with lab cultures in an effort to determine which antibiotic is best to treat it so that we hopefully stymie the antibiotic resistance. However, there is growing concern with antibiotic resistant strains of Enterobacteriaceae, and in 2015 they actually found they had an increase in cases of infections with carbapenem resistant Enterobacteriaceae, and these individuals had undergone upper endoscopy procedures in a hospital, and the endoscopes were not cleaned correctly. The way that they were designed made it very difficult for them to be cleaned properly, and so this bacteria was residing within it, and with every use was being transferred to another patient. Morganella, Proteus, and Providentia are members of the family of Enterobacteriaceae. Morganella and Proteus are found in the GI tract, whereas Providentia is typically found in soil, water, and sewage. There's only one species of Morganella, and that's Morganii, and it is considered an opportunistic pathogen. It has been known to cause UTIs, surgical site infections, and also infections in the brain, in the heart, in the eye, as well as peritonitis. Those that are at a higher risk are those that have diabetes or the elderly, those that have a history of exposure to certain antibiotics like ampicillin, and those that have had a snake bite. Proteus, on the other hand, we're going to talk about a couple different strains of Proteus. The book mentions is Proteus mirabilis, Proteus vulgaris, and Proteus panneri. All of these organisms cause something called apoptosis, which means cell death or cell suicide, and epithelial cell desquamation. Again, often are the cause of urinary tract infections. Those that have a indwelling catheter that has been in use for a long time are at a higher risk, typically those that are at long-term healthcare facilities. It also increases the chance of kidney stones, which can cause urinary tract obstructions as well. There are some non-urologic infections associated with Proteus, and those typically present themselves as abscesses in the soft tissue. And the way that we treat this is with broad-spectrum antibiotics. Now, Providentia, again, mainly affects the urinary system, and it got its name because it was studied at Brown University in Providence, Rhode Island. So that's how it got its name. One of the most common strains is P. stewartii. I wonder if Stewart was the one who actually discovered it, and then he got it named after him. Reservoirs for Providentia include various animals like cats, dogs, birds, sheep, cattle, guinea pigs, penguins, and snakes. It's normally found in the urinary tract, but it can also be responsible for some foodborne diseases as well. Those that are at higher risk are the individuals that have long-term indwelling catheters and those that have ventured out to foreign countries. Again, treatment is antibiotic therapy. Serratia is a small motile peritrichous bacteria that is considered an opportunistic pathogen, and it secretes a pigment, this kind of pinky red pigment that you can see up here in the top corner, and it has been known to have some immunosuppressive and anti-tumor properties. So they're testing it in labs to see if it might be able to help us treat other diseases. If a breastfeeding mom becomes infected with the Serratia marcescens, that can infect the breast milk and produce that pink pigment that's associated with the bacteria. I thought that was interesting. It's also common in healthcare acquired infections and can lead to infective arthritis, endocarditis, osteomyelitis, meningitis, and bacteremia, as well as UTIs, respiratory infections, and as well as infections of the eyes and soft tissues of the body. The way that we treat this is with appropriate antibiotic therapy. Now let's talk about the genus Shigella. Shigella is a facultative anaerobe. It is gram-negative, and it was discovered by a Japanese microbiologist named Shiga. And so that's how it gets its name. And there are several groups A, B, C, and D. Group A is the causative agent for dysentery, which is typically found in developing countries that have poor sanitation practices. Groups A and C are hardly ever encountered in the United States. Group D, we find that they account for about 2/3 of the infections, and then Group B for the rest of the cases in the United States. And this group of bacteria cause infections that they named shigellosis. Salmonella, on the other hand, is a rod-shaped, non-spore-forming bacteria, and they do have flagella, so they can move about the country. And there are more than 2,500 serotypes of Salmonella, and most of them are pathogenic to humans. There are 3 major serotypes that we're going to talk about, which are Salmonella enterica. The group is Salmonella enterica, and there's 3 within that group, and that is Typhi, Typhimurium, and Enteritidis. Let's see, Salmonella typhi is responsible for causing typhoid fever, which causes fever, nausea, vomiting, diarrhea, and can lead to death. It's not very common in the United States, but again, is seen frequently in developing countries. It's transmitted via the fecal-oral route through the ingestion of contaminated food or water with the bacteria typhi. It is not destroyed by the macrophages in the immune system, and it's only pathogenic to humans, interestingly. So if it does get engulfed by a macrophage, then it just continues to multiply within it. And there are some that can survive the environment of the stomach, and if that is the case, then they get into the small intestine, and in the section of the small intestine where it joins in to the cecum, so that the ileocecal junction, these bacteria bacteria will invade the tissues there. There's these lymph nodules that they refer to as Peyer's patches, and they will take a ride through the lymphatic system and then get into the circulatory system. And so then we may see hepatomegaly and splenomegaly as a result of that. The cells also like to persist in the biliary system, and the first documented carrier of Salmonella typhi was Mary Mallon, and we nicknamed her Typhoid Mary, and she was determined to be a permanent carrier of typhi, and sadly was quarantined for her entire life once they identified that she was a permanent carrier. Salmonella typhi murium is predominantly responsible for foodborne illnesses. There have been outbreaks in large meat processing plants. It has also been linked to live poultry as well as pet reptiles. The symptoms that you get if you're infected by typhi murium are similar to those of Salmonella typhi, but typically not as severe. Now, Salmonella enteritidis is largely associated with poultry and hens laying eggs, and the bacteria is on the shells of the eggs. Now, when this was determined, there was like a whole bunch of other protocols and stuff that started to happen so that the shells could be cleaned and that bacteria could be removed. However, now there are colonies appearing in healthy hens' ovaries, and because of that, the eggs are contaminated on the inside and not just the shell, and therefore they can't be cleaned. So don't eat raw eggs. That's the moral to this story of Salmonella enteritidis. Lastly, Yersinia. We're going to talk about that. Yersinia, again, is a member of Enterobacteriaceae. And there are three main species that we care about in this lecture, and that's Y. pestis, Y. enterocolytica, and Pseudotuberculosis. These cause severe gastroenteritis, can lead to abscess formation, and possible death due to peritonitis. So in this lecture, we're only going to focus on pestis, but later on we'll talk more in depth about the other two. So pestis is gram-negative, it's a facultative anaerobe, and it's an obligate intracellular pathogen. So it needs to get into the host cell for it to be able to survive. It causes three forms of plague. It causes the pneumonic plague, septicemic plague, and the most famous of all, not Rudolph, but bubonic plague. Okay, bubonic plague was also referred to as the Black Death and was responsible for the death of 25% of the population south of the Alps from Asia and India to the Middle East and over to the Mediterranean region. 25% of the population. The plague was also responsible for killing about 1/3 of the world's population between the years of 1348 and 1530. And then in China, between the years of 1855 and 1910, it killed an estimated 10 million people. Humans can become infected with Yersinia pestis by getting bitten by a rat flea. So at first, when the bubonic plague struck, they thought rats were the reservoirs. They blamed the fleas as being the vectors or the reservoirs. And what they actually found is that the plague was in the rodents, and the fleas were biting the rodents and then biting humans. So the rats were actually the reservoirs for the disease. So we could get it that way. It is also can be inhaled through droplets if somebody has it and they cough or sneeze. And then, of course, exposure to blood or body fluids or tissues of anyone who is infected with it. Once infected, the bacteria is going to quickly spread to the lymph nodes closest to the site where it entered the host, and then there's going to be an inflammatory reaction there, which is characteristic for the disease. Due to its virulence, we want to make a very quick diagnosis because there's a rapid progression of the disease, and death can occur within 24 hours after the patient is showing signs, the first signs of infection. We treat it with some antibiotics, gentamicin, streptomycin, and tetracycline. Thank you, Streptomyces, can fight those. There are some drug-resistant strains appearing out there. Moraxellaceae includes cocci as well as bacillus bacteria, and we discussed Moraxella a little bit in chapter 15. And we're specifically going to concentrate on Acinetobacter baumannii, which is the most commonly identified member of the Moraxellaceae family. And they're responsible for a majority of healthcare-associated infections. In fact, A. baumannii is responsible for 80% of healthcare-associated infections, or acquired infections, excuse me, and likes to live in a fluid-type environment. It can live on the skin as well as inanimate surfaces and is typically found in ICU and rarely found outside the healthcare setting. It likes to live on or in central venous catheters, trach tubes, urinary catheters, and open wounds. It can also infect the lungs, the bloodstream, the urinary tract, and the central nervous system. They also have a strong resistance to antibiotics. So we just want to make sure, as with every other organism, that we wash our hands properly and we prep patient's skin properly to prevent cross-contamination. Now we're going to switch gears and talk about the family Pasteurellaceae. Pasteurellaceae are non-motile, non-spore-forming, and they can either be aerobic or facultative anaerobic. The first one we're going to talk about is Pasteurella. And Pasteurella is named after Louis Pasteur. And it is a pleomorphic bacteria appearing either as bacilli or cocci, and it is commonly a part of the normal biome in the oropharynx, and it's found in several types of domesticated animals for the most part, and the way we get it is by getting a bite from one of those animals or from a bug that has bitten one of those animals and comes and bites us. The one that we're most concerned about is Pasteurella multocida. And this is the most commonly known one that is harmful to us. And there are 4 forms. There's a localized form, a respiratory form, septicemia form, and an endocarditis form. Once an individual has a bite from one of these animals or a vector that has bitten an animal and bitten us, the bacteria have a tendency to multiply rapidly, and then it's important to wash it, irrigate it, and treat it immediately with antibiotics. 2 additional members of the Pasteurellaceae family is Haemophilus and Actinobacillus. Haemophilus is a non-motile gram-negative rod that grows in pairs, so it can appear as diplobacilli or streptobacilli, and these are facultative anaerobes, and they're typically found in the mucous membranes of the respiratory and genital tracts of humans. Now, Haemophilus means blood-loving, and they got their name because most of them require factors that are present in the blood. Now, they can be inhaled, that makes sense. They colonize in the respiratory tract, or they can be transmitted through direct sexual contact, which makes sense as well because they colonize in the genital tract. The most recognized species is Haemophilus influenza, and this causes bacterial meningitis in infants and children, as well as respiratory tract infections in older children and adults. And the elderly are also prone to getting bacterial pneumonia due to this Haemophilus influenza. It was first isolated in 1892, and it doesn't cause what we refer to as the flu. It is actually a bacteria, and it has some specific virulence factors, which includes peptidoglycan, which allows it to damage the blood-brain barrier so that it can get into the brain. It also secretes various exotoxins as well as enzymes that allow it to adhere to tissues. Now, Haemophilus ducreyi was named after Ducrey, who discovered it in 1889, and it is only found in humans. It's kind of confusing what their virulence factors are. Scientists still aren't sure, but they think that they might secrete some types of cytotoxins. This organism is spread through sexual contact, and it is endemic to parts of the world where there is poor socioeconomic and sanitary conditions. Here in the United States, it's most commonly found among drug abusers, sex workers, and alcoholics. Actinobacillus is mostly responsible for diseases in animals, but there is one specific species that is responsible for periodontal disease, and that is Actinobacillus actinomycetocomitans. And that is a small gram-negative bacilli or coccobacilli, and it has been identified to also cause dental plaques and biofilms on the teeth. Vibrionaceae is a straight or curved rod-shaped bacteria with flagella at one or both ends. There are 12 species-ish of Vibrio, and they're divided into two categories, cholera and non-cholera forms. And then the non-cholera forms are divided into two classifications, which are halophilic and non-halophilic, meaning do they like salt, do they not like salt. The non-cholera Vibrio are most closely associated with foodborne diseases, such as ingesting infected seafood, mainly oysters, and that is due to Vibrio parahemolyticus. And this is a natural inhabitant of the coastal waters of the United States and Canada, and there's annually about 215 confirmed cases, but they suspect there could be quite a few more. Vibrio vulnificus is responsible for more serious infections, especially those in immunocompromised individuals. That can lead to shock and bacterial septicemia and a 50% fatality rate. Those with liver disease have an 80% chance of suffering from septicemia than those that don't have it and become infected. A while back in 2005, if you remember Hurricane Katrina, there was an increase in infections with Vibrio vulnificus because of the disruption and contamination of seafood habitats. Lastly, Vibrio cholerae causes the GI disease cholera. And they've been talking about it since about 400 BC. And it has the ability to typically, let me start over. Typically, Vibrio cholerae is killed by the extremely acidic environment of the stomach. However, if we have individuals that have had like vagotomies, which we cut the vagus nerve there near the pylorus, and that is going to reduce the hydrochloric acid. So it's going to reduce the level of acid in the stomach. And that can put an individual at an increased risk of an infection with Vibrio cholerae. And then malnutrition can also elevate the risk. And those with O blood type, for some unclear reason, are also at a higher risk of becoming infected. Aeromonadaceae is a non-spore-forming rod-shaped bacilli or coccobacilli, and these are facultative anaerobes. They are found in freshwater, saltwater, soil, sewage, and in some foods. There are two groups, those that are motile and those that are non-motile. There are 6 species that are known to be pathogenic to humans, and they suspect that the species A. caviae and A. sobria are the causative agents in regard to some gastrointestinal infections in immunocompromised individuals. Pseudomonadaceae is a bacteria that is gram-negative. They are either short, straight, or slightly curved rods, and they do not form spores, and they are motile. Some strains form a slime layer either around themselves individually or around colonies, and this can improve their virulence. Pseudomonas is found worldwide, and it has the ability to survive adverse environmental conditions and has fairly low nutritional requirements. It's a good example of an opportunistic pathogen, and the one that we're going to talk about is Pseudomonadacea aeruginosa. And this guy can live in many areas of the hospital: sinks, drinking fountains, cleansing, soaps, and patient humidifiers. It is also highly resistant to antibiotics. It can also live in areas like hot tubs and swimming pools. It has been known to cause conjunctivitis in those that wear their contacts for an extended period of time, and it also attacks those more viciously if they have a weakened immune system, are on the ventilator, and or have a tracheostomy. Okay, hang in there with me. We are coming into the home stretch. Just a couple more to talk about here. We're going to talk a little bit about Campylobacteraceae. It is a gram-negative microaerophilic non-fermentative spiral-shaped motile rod. It has flagella, either unipolar or bipolar, and the two common ones are jejuni and coli, and then a third one, fetus. And so the jejuni and the coli are most common in causing foodborne infections, while fetus is responsible for spontaneous abortions in sheep and cattle. It's also opportunistic in humans. So we're just going to talk about jejuni, and then later on we'll talk more about these Campylobacters. So Campylobacter jejuni is highly sensitive. It prefers an atmospheric environment, so 3 to 5% oxygen, 2 to 10% carbon dioxide, and it can be found in birds or manure that is contaminated, like chicken manure, and that can be transferred to the milk that comes from cows, and then that can lead to foodborne diseases in humans. Some studies show that C. jejuni is the leading cause of diarrheal illness in the United States, even more than Salmonella and Shigella. In some cases, there's some weirdness that happens, and if the patients have for some reason have a hyperimmune reaction to the bacteria, this causes the body to attack its own nervous system, and this can lead to a disease called Guillain-Barré syndrome, and that can result in paralysis of the individual. But they have found that once they established strict regulations for food handling and preparation, that those types of diseases have declined significantly. Helicobacteraceae is a gram-negative bacteria. It is microaerophilic, and it's very similar to Campylobacter. These guys are motile, and they are thought to be the causative agent of chronic gastritis and stomach and peptic ulcers. Helicobacter pylori we're going to talk more about in upcoming chapters, but suffice it to say for now that they get the blame for peptic ulcers. However, the book indicates that their pathogenicity is not well understood as of yet. The book talks about 3 additional gram-negative pathogens, and those are bacteroids, P. gingivalis, and Fusobacterium. Bacteroids are obligate anaerobic bacteria. They are commensals in our small intestine and colon, And they do a lot of good things for us. They help us in digesting nutrients and breaking it down. They compete for the food supply that other pathogens could have readily available to eat if they weren't there. They also help with the biotransformation of bile acid, and the problem is that when these bacteroids get out of the GI tract, then they can invade and colonize in the peritoneal cavity and cause abscesses. P. gingivalis is an anaerobic encapsulated bacteria that is found in the mouth of humans, and it's an opportunistic pathogen that leads to periodontal disease, and it can also cause biofilms. It's also been implicated as the cause of inflammation leading to atherosclerotic plaques that we see in cardiovascular disease. Fusobacterium is a species that's similar to bacteroids, but they are much more virulent because they produce an endotoxin. Some that are important medically are F. nucleatum, F. mortiferum, F. necrophorum, and F. vivarium. And these can cause infections in the head, the neck, sinuses, liver, the gums, brain, and abdominal cavities. And that is going to conclude our review of Chapter 16. I know it was a little bit lengthy. I hope that it was informational and helpful. Thank you for listening.